Now we're going over chapter 17, and we're going to cover stimulants. I want you to know the key points, and this is basically to review over the chapter 17 PowerPoint. So you could basically go over it as I'm reading. But with central nervous system stimulants, you're dealing with numerous drugs that can stimulate the central nervous system, which involves the brain, spinal cord, and regulates body functions. And we have the amphetamines and caffeine. It acts, on the brainstem and medulla to stimulate the respiratory system. So you can, it's basically the fight or flight, act on the sciatic center to the hypothalamic region and limbic regions. They are thought to actually suppress the appetite. So medically approved use of the stimulants are limited to the treatment of attention ADHD, basically in children, narcolepsy, and the reversal of respiratory distress. A major group of the stimulants include amphetamines and caffeine, which stimulate the cerebral cortex of the brain. Analeptics, which actually act on the brain stem and the medulla to stimulate respiration. And then we have the anorexiants, which are thought to suppress appetite by stimulating the satiety center in the hypothalamic and limbic areas of the brain. Now we have, you can have the overuse or prolonged use can cause actually dysrhythmias and cardiac issues. You want to focus on that and what it can lead to. And with the, like I said, the long-term use of amphetamines can produce psychological dependence or tolerance conditions in which larger and larger doses of a drug are needed to reproduce the initial response. So that's what you see in a lot of children, and they say that as they grow, they need more medication for their ADHD, but as well as adults. But you'll see that people become tolerant to many drugs, and so they'll have to have a higher dose. Now, in gradually increasing a drug dose, then abruptly stopping the drug may result in depression and withdrawal symptoms. You'll actually see people that are taking this when it wears off, the change in the mood and behavior. ADHD may have caused by a dysregulation of the transmitter serotonin, norepinephrine, and even dopamine. I say before, they used to hand it all out, and in bigger cities, you're seeing that physicians are actually making the children go through sleep studies before they actually prescribe the medication after doing the testing on the computer for attention deficit. ADHD occurs primarily in children, usually before the age of 7, and may continue throughout the teenage years. In some cases, it may not be identified until early adulthood. Now, narcolepsy is characterized by falling asleep during normal waking activities, such as driving a car, talking with someone, just through their daily activities. Now, sleep paralysis usually accompanies narcolepsy and affects the voluntary muscles. So, something you really need to address. Now, you look at your different amphetamine like drug for ADHD. They're all class 2. Dexamethasone, which is more of a sodium based, and the uses increases the attention span and cognitive performance, helps with memory and reading, decrease in impulsivity, hyperactivity, and restlessness. Sometimes it's really widely used in this day and time because of the class 2. Is because of the fact that it's put in that category because of the potential use, for abusing the drug. Now, with amphetamine stimulant to release the neurotransmitters, the norepinephrine and the dopamine from the brain and the sympathetic nervous system, and inhibit the reuptake of these transmitters. Now, these drugs have a high potential for abuse, just like I said, and the tolerance and the dependence. Excessive use may lead to actual psychosis. They say that ADHD can be a precursor to a bipolar. That is one of a hypothesis that has not totally been proven, but that is one of the theories they have. And dysrhythmias can actually occur with some of the medications that they take. So you have to really watch at the signs of your children or whoever's taking the medication over continued use. When your child says they're feeling a certain way, you want to definitely not. You do want to address it because it could actually be something serious. Now, with the methylphenidate and the dexamethasone classed as amphetamine-like drugs, are given to increase the child's attention span, cognitive performance, and decrease in impulsivity, hyperactivity, and restlessness, like I said. But just remember what can be associated with that. It can cause dysrhythmias and over the continued use. Now, the methylphenidate is also used to treat narcolepsy. It's and modafinil is a amphetamine-like stimulant that increases the wakefulness in patients with sleep disorders such as narcolepsy. Anorexiants cause the stimulant effect on the hypothalamic and limbic regions of the brain to suppress the appetite. Now, you'll have, for weight loss attempts, emphasis should be placed on the nutritious diet, exercise, and not actually focused on decreasing the appetite. It's a certain mindset because it'll come back. Before you have to have behavior modification. And because if you get reliance on the appetite suppressants, should be discouraged because of the fact that you can get actually dependent on them. Analytics, which is a central nervous system stimulant, mostly affect the brainstem and the spinal cord, but also affect the cerebral cortex. The primary use of analytic is to stimulate respiration. Now, one subgroup of the analytics is the xanthines, which is the methylexathines, which caffeine and ethylphenylene are the main drugs. Now, depending on the dose, the caffeine stimulants of the central nervous system and large doses, respirations, you'll see newborns with respiratory distress might be given caffeine to increase the respiration. Theophylline is used mostly to relax the bronchioles. However, it also has been used to increase respiration in newborns. And then you also have to remember with your children that you're putting on the stimulants for your ADHD, their weight has to be monitored because it actually can suppress growth. And so they have to measure and weigh on every visit. Okay, so if you have any questions whatsoever with this chapter, you can always email me. We'll go ahead and conclude and go on to chapter 18.